Hi everybody, I'm Oscar Delgado, CEO of Community Health Alliance. I've been with the organization for a little over 4 years now, where I initially came on as Director of Community Relations, then promoted to Chief Strategy Officer, and then really honored and blessed to take over as CEO in October of 2019. Community Health Alliance's service area is Washoe County. It's located in northern Nevada, and it's home to the cities of Reno and Sparks. It's also home to nearly 500,000 people. Like a lot of other places in the U.S., it also has an issue with access to care. Washoe County qualifies as a health professional shortage area. In fact, we would have to increase our overall providers in our community by 157% to meet the demand. Here at Community Health Alliance, one of the ways we're trying to fill that void with respect to our healthcare provider shortage is by growing our footprint. In the city of Sparks, we are expanding our health center by 2,500 square feet, where we're going to add 2 additional providers and a food pantry for our patients who are food insecure. Here at Community Health Alliance, we serve over 21,000 patients. Of our patients, 90% of them fall below 200% of the federal poverty guidelines, and 50% of them are Medicaid recipients. We serve all of our patients at 7 fixed sites. We also have a mobile medical unit and a mobile dental unit. Of course, all of our sites are in our most underserved communities.
My name is Ithne Marie Barton, and I am a DO, and I am the Chief Medical Officer here at Community Health Alliance. We've grown from a company that I think was under 80 people to now a company that's close to 300 people. And in that, we've experienced enormous growth in some of the services that we provide. We also have behavioral health and integrated health that has grown since we became Community Health Alliance over the last several years. We also have a food pantry. So there are so many things that we have done and grown to better serve the community in which we live in. We currently have 28 medical clinicians, and so we have 8 physicians, 12 nurse practitioners, and we have 8 physician assistants, and they are divided among our 7 health centers. About half of our medical clinicians are bilingual. Most of our staff speak some Spanish, but we use a translation or a language line service for translation for other languages also. So not only for Spanish for people who are not bilingual, but also for things like Tagalog or Mandarin or Farsi. Those are the services that we use the language line service for. We're general primary care, so we offer services for people in the community from, for those of us who like to say cradle to the grave, or from 0 to. We have pediatricians who service our population from 0 to 18. We have family medical clinicians who are advanced practice providers, but then also physicians. Then we also have behavioral health components as well, and we have clinical pharmacy. We do urgent visits, so same-day sick type visits. We do preventive medicine as well, so people can walk in the door, and if they are overdue for age-based screenings, point-of-care testings, in terms of cervical cancer screening, we do pap smears here. We also do breast exams, but we do refer out for things like mammograms. We don't perform those here. But we have access to those services in the community because of the relationships that we have with various imaging organizations around the metro area. Other things that we can do, point of care, HIV screening for our age-based, so that's one of the big pushes that we've seen nationally, and that's one of the things that we're working on. We also do sexually transmitted infection screening, as well as when people come in with symptoms, we screen and we're able to test right here on the spot for some of those tests, and then we send out those to labs. You can also access colon cancer screening because we set people up with FIT, where when patients are uninsured, we have access to be able to provide that service for them, or we use their insurance and we set them up with a packet and they can go home with that. We show videos in the office as we educate people about exactly how it is, how they need to complete that FIT in the comfort of their own home. And we find out also if they're not appropriate for a FIT, which is a fecal immunochemical test. If there's a family history of colon cancer, we need to go straight to colonoscopy, and that's going to be a referral to one of our gastroenterology partners in the community. Some of the screening screenings that we can perform here, age-based screenings primarily, so sexually transmitted infections, hepatitis C, HIV screening, cervical cancer screening, breast cancer screening. We also do osteoporosis screening for our men and women age appropriate.
My name is Jen Wheeler, and I'm the Chief Pharmacy Officer at Community Health Alliance. Our pharmacies participate in the 340B program, which enables us to provide high-quality, low-cost medications to our patients that have diseases such as diabetes, hypertension, hyperlipidemia. It allows them to get medications they wouldn't be able to afford anywhere else. We developed a delivery program when COVID-19 first started happening. We realized that as things in our community were closing down, patients weren't comfortable coming into the health center, and we needed to be fluid and figure out a way to get them their medication. And we were able to deliver upwards of 30 deliveries a day to our patients using the pharmacy. It's a free service that we offer. We've reinvested the funding that we make off of our 340B program to provide that service for our patients. Community Health Alliance has a diabetes education accreditation program, which is nationally certified by the Association of Diabetes Care and Education Specialists. We reinvest our funding from 340B savings into what's called an ambulatory care program, where our pharmacists sit down and provide diabetic education for our diabetes patients. Some of the benefits our patients receive from our program include personalized medication management, which helps break down any barriers that they would have to non-adherence to their prescriptions, a customizable plan for nutrition as well as exercise. Part of our national accreditation is to follow the national standards for a diabetes self-management program. So it really gives our program some structure and guidelines to follow according to the CDC.
So for voluntary family planning, we access our reproductive health grant services. We are able to see all ages, and so what we are able to offer Nexplanon, we're able to offer IUDs. We also have full scope in terms of if, as part of the process, a pap smear is performed and it's abnormal, we have the ability to do a colposcopy here on site as well. We know that in this pandemic, STIs have been on the rise. We often will screen people who are coming in who may not have symptoms, and we catch things like chlamydia, gonorrhea. We report it to the health department, but we also treat, and we offer treatment to the sexual partners as well. The Reproductive Health Grant, the Title X grant, has allowed us a lot of opportunity to expand services and be able to provide services to those of our patients who are underinsured. So it may be that what they have doesn't cover the reproductive health service, and that's where the Title X grant really does help out. Immunizations are a big part of what we do. We feel like we are one of the bigger public health service organizations here in Washoe County. We distributed the third most vaccines against COVID-19 in our larger community, which is huge given the size of our organization. In terms of routine vaccinations, so we offer all age-based vaccinations. We find that around the time that school is beginning, that we have to sometimes catch kids up, and so we are the mechanism in which kids are able to access school services, because without getting their vaccines updated, if we're not able to get them in quickly, then they aren't able to access their school system. And that looks a little bit different with COVID-19, but still being able to access the system. We've won awards with Immunize Nevada for our age-based vaccination efforts. Every year we do a back-to-school event. We do various things with our partners in the community about getting vaccines out there. And one of the things that we do for immunizations, we feel so strongly about people and using our pharmacy services for immunizations. They don't have to be our patients. We open it up into the entire community.
Right now, we are heavily focused on COVID-19 vaccines. However, we understand that over the course of the pandemic, there's been a lot of children that have been affected, not being able to come in and get their well child checks and not keeping up on their immunization schedules. So we've already partnered with Immunize Nevada and the Washoe County Health Department and the Boys and Girls Club to get our vaccine van out at 3 different locations this summer and help get children caught up on their back-to-school vaccines before school starts this year.
One of the things that we've been able to do as part of our well child services is we do the routine things. Here in Nevada, where there is no fluoride in the water, we have to make sure that fluoride application is part of our routine well child checks here on medical side, but we've also done some integrated work with our dental staff to bring our dental hygienists in, and they actually do an initial evaluation, and then they introduce our patients and their parents to the idea of a dental home as well. There's no downside to being able to do that, and so that's been a big win in our organization. Right now, at least at Wells, it's very easy because our dental staff are actually physically in the same building as our medical staff, so that link is very easy. But even at our elder health centers, we want to make sure that our parents are aware of the ability to get their kiddos in. Our Healthy Living program was started about 5 years ago by our pediatrician, Dr. Stephen Shane. He just recently became the first obesity medicine certified pediatrician in the state of Nevada, which is a huge honor. The genesis of it is out of a program in Maine. It's the 5210 program, so it's 5 fruits and veggies a day, 2 hours or less of screen time, you want 1 hour of physical play, and then 0 sugary beverages. We're looking really at expanding it more to our whole organization because we know that if parents aren't on board, kids don't have a chance in terms of their access to services and weight reduction. So one of the other services that we provide in concert is the food pantry, and Dr. Shane has been able to also bring in outside sort of experts from the community, teaching yoga, getting bikes for kids. So there's just this amazing sort of synergy in the community, in the Truckee Meadows community at large for obesity prevention. We identify in the course of our visits with our patients food insecurity. And none of it's a surprise to any of us these days, but even prior to the pandemic, food insecurity was a big issue, especially for our patients who have diabetes or even hypertension, high cholesterol. There are diets that patients are supposed to follow or try to adhere to that can be very difficult depending on the access to services they have in the community. We now have several pickups throughout the week to get food, and when we weren't having patients here in the health center during the height of the pandemic, we were still delivering food to the parking lot so patients could come and get access to healthy food. We as clinicians write a food prescription for our patients, and so that is how they identify it. And our nutritionist looks at the menu that we have available every day, and so she's able to give to our food pantry volunteers from the community to let them know what foods our patients are eligible for based on their diagnosis. It's really a comprehensive service that we do where we touch multiple disciplines in order to get our patients healthy food for their conditions.
My name is Paul Eaton, and I've been coming to the Community Health Alliance for 3.5, 4 years. I have been working for 34 years for the same job, and then a company bought us and they didn't hire anybody when they did that. And so started having some medical problems. Someone told me, oh, you need to go and apply for health care because I didn't have insurance anymore. And coming to see for basically every 6 months, make sure my diabetes is under control. I was a person that pretty much ate 1 time a day. I would eat dinner and eat a huge dinner. Chelsea Doyle actually asked me, oh, would you like to get some food? And I go, yeah, sure. And so I signed up. I was surprised because you could come every week. I was amazed, at all the fresh vegetables and fresh fruits that you get, which is really good. And it's made me eat that much better by getting that. And since then, I've pretty much come every week and got some food. The Community Health Alliance has been great in impacting my life.
One of the things that has been an additional complication in the pandemic is getting our patients experiencing homelessness, getting them into our health centers to access services. Oftentimes they don't have phone numbers, they are constantly on the go, and so right now we are servicing them at any of our health centers, making sure that there are no barriers to care wherever we are open, but it's not been easy. We do have a particular staff member who has been able to get cell phones to our patients, and we have a staff member, really, Miguel, dedicated to being on site with our folks experiencing homelessness. So he is on the move, on the streets, making relationships, following up with patients because he knows where they might hang out and he knows how to be able to follow up with them. So it's not been easy, certainly to coordinate services for our patients experiencing homelessness, but one of the things that we even have here is we have clothes to give people when they come in. So even here at Wells, we have a box of clothes at the ready when patients need something beyond what they have. One of the things that I think that our organization is proudest of is the Center for Complex Care, which is now about 5 years old. And it was really something that was new and innovative at the time and still remains something unparalleled in our community. But we found a way after kind of doing a national research on how do we take our biggest users of resources among our patient population, those with the greatest number of comorbidities, the most difficult social determinants of health in terms of managing their health and their overall well-being. How do we take that population and separate it out from the walking well who just need to come in once a year or for their routine screenings and wellness visits? And so we created the Center for Complex Care, and it's a little bit different from integrated behavioral health because each team, we have 3 teams there, and we have a medical provider, so a medical clinician, we have a medical assistant, we have a care coordinator who functions almost as a care manager, and then we have a behavioral health provider as well. And that's apart from just the regular runnings of the healthcare center over there. And so we really go over in depth what the patients need, what their goals are, and really moving them forward. Turns out when we began that we thought that we would be able to transition many of those patients back to their other ambulatory care centers in the community. With the pandemic, we've not been able to fix or access services that are really going to get them back to those health centers. So it turns out that right now, we're now looking at the next phase of how many people can we keep there and what do we do with this health center in terms of growing the services that we have, because there is that need. But it's an amazing service because of that clinical and then that team approach that is like no other. The visits there are longer, and the expectation is that everybody has a behavioral health provider that they'll see on top of their care manager. And it's been a really well-received part of what we do in the community, within our own community, but also within the community at large.
I was CEO for 5 months when the pandemic hit. And like a lot of other community health centers out there, we had to scramble. I'm finding ways on how we can be innovative, creative, and more than anything, safe for our patients and of course for our team. A few of the things that we did in response to the pandemic is we shifted 70% of our visits to telehealth. Second, we allowed many of our team members to work from home remotely, where they continue to work remotely to be safe with their families. And third, we got health screeners at all of our health centers to make sure that our patients feel safe as they come in.
A little over a year ago, we made a really big leap to move to remote visits in order to make sure that our health centers were safe for our employees and for the community at large. And so we quickly, in the span of several weeks, flipped to telephonic visits. Many of our patients don't have the access to smartphones or even internet, so it wasn't possible to do true telehealth visits with them via video. However, we were able to do telephonics and make sure that we were reaching out to them, screening them for COVID symptoms, helping them access testing if they needed it or services if they needed it. And so we flipped really quickly from 100% in-person visits to about 75% telephonic or remote visits. A year later, we are now flipped again to about 25% remote visits and about 75% in-person, because now we're able to do that. Most of our staff is vaccinated, and so we're able to bring people back into the health centers, and we're working on that transition between, instead of keeping people who are sick out of the health centers, bringing people back into the health center, and that's going to be one of the things that we're working on in the next several months.
I'm proud of our team here, who stepped up in a critical time to provide vaccinations for our most underserved.
Community Health Alliance decided to take a really strong role in our community and get out there and offer COVID-19 vaccines, not only to our patients, but to the community in general. In the past, we have been certified as a point of dispensing in the event of a natural disaster. We were trained to be able to offer what's called a pod or point of dispensing, which is a mass immunization effort. So we took that knowledge and incorporated it as soon as the vaccine became available, and we started implementing that at our health center at the Wells location. We offered 3 Saturday point of dispensings where we vaccinated between 500 and 800 people on each of those days. And then daily, we offered a drive-up option. Patients would drive up to the back of the health center and we'd come outside and give them their vaccines. Each of those days, we were able to vaccinate upwards of 200 people, and in total, we've vaccinated over 10,000 people. We're the first federally qualified health center in Nevada to start immunizing. In Washoe County, we're the 3rd largest vaccine provider, aside from the Washoe County Health Department and Reno, which is one of the major hospitals locally.
To this day, we've given over 10,000 vaccines, the 3rd most in our county. One of the ways we've been able to achieve such a large number is through a mobile medical unit, which allows us to go directly into people's neighborhoods to make sure that they have access to those vaccines.
Working with our community partners, we were able to identify some neighborhoods that were impacted significantly by COVID-19, and we've made arrangements to get our vaccine vans into those specific zip codes so that we're able to equitably offer vaccine to all of our community, not just centered around our Wells location.
Good morning. My name is Melinda Mendoza, and I'm the president of Community Health Alliance's board. I've been on the board 6 years and have loved every minute. Immediately upon joining Reno Health and moving to Reno, Nevada, I looked for an opportunity to volunteer in a meaningful way. And I heard about Community Health Alliance and it being a federally qualified health center here in Reno, Nevada. And I felt that passion immediately by making sure that Community Health Alliance was here to provide medical care to the most underserved in our community. I'm especially proud to serve on the board because of its diversity. We have 7 Latinos and 6 women on the board. Not only are we diverse in that way, we're diverse by our backgrounds. We have members who are physicians in the community. We have a member who's a professional boxer. We have a social worker, and we have a board member who represents the homeless population here. So really proud to serve with that group of people with those very diverse backgrounds that helps us really understand the population that we serve from their perspective and puts us in a position to be better able to care for them. Our board has many important duties, including selecting our chief executive officer, approving budgets, approving policies. But in my opinion, the most important work that we do is ensuring quality care to our patients. That, coupled with employee satisfaction, is of the utmost importance to me as a board member. If we have happy employees coming into work, proud of the work that they do, it will ensure that that translates into better care for our patients. The mission of Community Health Alliance is especially important and personal to me. I have a fundamental belief that it is a basic human right for all to receive the care that they need. When people come to us, they're in a vulnerable place, and we have practitioners and a team of leadership who provide care in the most caring, empathetic manner. And since I look at it as a basic human right, I'm really proud to be part of Community Health Alliance.
My name is Alex Carlos Woodley, and I serve as the Vice President of the Governing Board for the Community Health Alliance. I've been serving on the board for the past 8 years. So one of our roles and responsibilities is to ensure that we provide a high quality of care for our patients, and we try to conduct surveys for patient satisfaction because we want to make sure that we treat our patients with the highest respect and quality, and that they feel comfortable when they visit our health centers. Our mission at Community Health Alliance is important to me because as a recipient myself, growing up, especially as a child grown in a low-income area, it's very important that they have high-quality health care and that they're provided with services that some might believe or think that they would otherwise not receive because of their financial situation, socioeconomic status. We want to make sure that they receive the good and the same high-quality health care as everyone else in our community.
I appreciate you taking an inside look at the services we provide here at Community Health Alliance. I want to thank our team and our patients for making this happen.